Dr. Kavita Patel is a public health expert who helped in the response to the H1N1 flu outbreak when she worked in the Obama administration. She's an NBC News medical contributor. Dr. Patel, good morning. It's good to see you. Anyone who thought this country had turned the corner on coronavirus need only look at those national spikes this week, setting 3 new records for national cases, and all the spikes in those countries like Florida, those states, that Kerry just reported on. As you look at these cases, what is behind the spike here?
Yeah, there's a pretty interesting trend, Willie. So first of all, if you go back to 3 months ago, you could almost just literally take the map of where you see the spikes today and reverse with looking at the states where we had the spikes, as you recall, of course, kind of the Northeast corridor and parts of the Pacific Northwest and some of California. And it really is kind of an even flip. In fact, many of us months ago were wondering, well, where are we going to see, when and where are we going to see the trends in the South, particularly Florida? And that's exactly what we're seeing. So there's a couple of, we think there's several things happening. Number one, the reopenings certainly contributed to this. We are, in fact, also doing a lot more testing, but that doesn't mean we're picking up more cases. It just means that in the beginning, we were really only testing some of the more vulnerable people. Remember, people who got to the hospital, people at nursing homes, and now we're getting a pretty even sense that there is a growth, especially in younger people. But again, I'll reiterate, it's not just because we're testing that we're picking up more cases. We are seeing true what we call community spread. And how do we know that? We know that because for every person who gets infected, they are giving that infection to at least 1 to 2 other people. And we know that that shows a strong sign of person-to-person spread, particularly in that 18 to 45-year-old age group.
And as you say, it really is following a pattern that public health experts like yourself have been telling us about since February and March, that it would die down a bit in these hot spots like New York City and then come back in other places across the country. Is that just an effect of reopening? What else is behind this?
You know, reopening certainly contributed to it. We also have now looked at trends in states that have had mandates around mask wearing. Just to be clear, this is now something that we have. Remember, several months ago, we weren't even sure if we should have people wearing, non-medical masks on their face. But now we have compelling data that just the simple act of mandating facial protection could decrease cases in half. And you did see early on when the evidence kind of emerged that states were pretty clear, particularly New York, et cetera, about mandating mask wearing. I also think that another contributing factor to this is somehow that we do think that the virus is just that infective. We know that congregate settings, or what we would call bars, restaurants, people getting together even in their homes, they've been frustrated being cooped in. So we know that that is the top source of people getting infections. And in the beginning, certainly even at stay at home, that was not necessarily the source of infections. So it's several things kind of all happening at the same time.
And now we're seeing big states like Florida and Texas rolling back some of that reopening, at least to try to tamp this down. Dr. Kavita Patel, always great to have your insights. Thank you so much.